The Center for Community Health and Prevention congratulates Dr. Mahala Schlagman for being a junior faculty recipient of the Dr. David Satcher Award for Community Health Improvement.
It is an exceptional privilege to have won the Community Health Improvement Award, named for Dr. Satcher, who has done a tremendous amount for our community and other communities in the United States. I really am accepting this award on behalf of several multidisciplinary teams that I work with, and it's really a tremendous privilege to see the work that I've done with those teams get recognition. Working with the community is an exceptional privilege, and as a primary care doctor, I often see some of the barriers that our patients are facing in the community that impact their ability to access medical care and to obtain the highest level of care. I think that looking upstream, meaning looking at some of the social determinants of health, or the factors that influence how our patients receive care, is a potential way to ameliorate some of the differences in their health outcomes. And it's a really great privilege to work with community agencies to learn more about the work that they're doing and collaborate to work towards impacting the social determinants of health. So over the course of the past few years, I have been incredibly lucky to work with a number of different teams on several projects related to community health. Our first project that we really started was called the Health Equity Advocacy Team, which became really a pilot group to develop a curriculum for internal medicine residents. The Health Equity Advocacy Team has now really become a group of advocates within our residency program who are interested in specific topics in community health, and we bring speakers in. As a really wonderful outgrowth of that, we now have a standard curriculum for our internal medicine residents, and we also have developed an elective in community outreach, which allows our residents to get out into the community, learn more about our patients in their homes, and also the community agencies that they are a part of. And then for the past 7 years, in parallel to that, since I've been in residency, we've been working on developing a medical legal partnership, which brings free civil legal services to the bedside, essentially, to our practice at Strong Internal Medicine and Highland Family Medicine, to help patients with legal needs that may prevent them from accessing medical care. So for example, a patient with diabetes who's about to be evicted, or schizophrenia, or a patient with bed bugs that we can't convince the landlord to get rid of. And that program really launched last year with a pilot grant from the Medicaid redesign program, and we're currently finishing up our pilot program, which is really exciting. I work with several community partners in my curriculum work, but our main community partner has really been Law New York, which is the civil service agency that provides legal care for our patients. They do an incredible job of providing service for some of our most high needs patients, to the point that some have even gone out to under bridges to help patients facing homelessness. And it's really incredible to see their dedication and the inspired work that they do, caring for those who otherwise wouldn't have a voice in the system. And learning about the work that they do and how it's impacted our patients really challenges me to continue to do that work each day for those who have the highest level of need. It has been incredible to work on community health projects, and my hope is really that at the University of Rochester, that the concepts that we emphasize in community health, the idea of thinking about what social factors are impacting our patients, and then impacting those in order to help them receive better access, better care, are integrated on a larger scale into not just the work that we do in general internal medicine, but into work done in many other departments and fields in order to really provide the best level of care. In terms of my work, I think the greatest hope that I could have is to demonstrate evidence-based initiatives that have helped our patients have better social and health outcomes over time. My greatest level of dedication is to that work. I also really am grateful for the many mentors, students, colleagues, friends who have supported this work, and I hope to continue in those partnerships over time.